Welcome back, everyone. My name is Kadra Abdul, and I'm your spokesperson for this public awareness campaign on chronic disease and Black health, brought to you by Taibu Community Health Center. Please join us in our next discussion on colorectal cancer as well as prostate cancer. Thank you.
Today's topic is prostate cancer, and we have our lovely guest who's very knowledgeable in this area, Dr. Sean Pierre. Thank you so much for joining us and taking the time to sit down with us. For the people that don't know you, please introduce yourself. How did you get in this field? How did you get into this conversation? I want to know so much about you.
Thank you. My parents are Trinidadian, so from the Caribbean. I spent some time growing up there, but I was actually born here in Canada. Came back to my undergrad at McGill and then med school at the University of Western Ontario in London, Ontario. Then I did my residency, so my specialty training in urology, which involves prostate cancer, in Queen's University in Kingston, Ontario. Then I went to Duke University in North Carolina for a couple of years to do just some extra subspecialty training in a couple of interesting areas in urology. And then I moved to Ottawa, and now I live here.
When were you not in school? That's what I want. You look very young, so I'm not sure. Did you start?
Oh, it's been a long time now. This is year 15 out, so
wow.
I'm getting there.
Well, academically, it brought you all the way here. This is incredible. Thank you so much for taking the time to have this conversation about, I'm saying it right? Prostate cancer?
That's right.
There you go. Yeah, so I don't know much about this. I'm not the medical expert. This is why we have you here. So I have my little notes. I've done my research. And so the one thing that I know for sure, prostate cancer is a type of cancer that develops in the prostate gland. But for the people that don't know, as well as myself, what is prostate cancer? And as well as what are some of the risk factors regarding this type of cancer?
Okay. Well, first of all, let's get something out there that most people don't talk about.
Okay.
What exactly is a prostate anyway?
There,
and what
there
does
you
it
go.
do?
Do I have one? I have a lot of questions.
It's a very good question. So
Yeah.
you only have a prostate gland if you're male. It is a part of the male reproductive system. It actually produces a lot of the nutritive fluid that keeps sperm alive and healthy for fertility and pregnancy. So it also has a secondary function in terms of continence. So that's why men tend to not become incontinent as they get older. This prostate gland produces basically a passive resistance that prevents them from leaking. And so during your reproductive years, it's a very important gland. Obviously, later on, it's probably more important for continence. Like most of the tissues in the body, though, it is prone to forming cancer, which is really uncontrolled replication and spread of cells. So basically, your cells are supposed to replicate and reproduce. Your cells don't live forever,
Right.
but they're supposed to do so in a controlled fashion, and they're supposed to stay where they are. They're not supposed to spread all over the place. Because when they do that, they cause disruptions in other places in your body. And that's actually the problem with cancer. It spreads or metastasizes is the fancy term for that. Mm-hmm. So a lot of our job as docs is trying to identify cancer early. Because what we see on TV and in our lives when we're really worried about it is cancer late. This is why we have screening programs where we try to pick up cancer early. And so you're thinking to yourself, well, what kind of things should I look out for in order to find this cancer early? Well, obviously if you're male, that's your risk factor, but it happens in older men. So before the age of 50, a diagnosis of prostate cancer is extremely rare. And then unfortunately—
That's before 50.
Before age 50, it's extremely rare.
Okay.
After 50 is when you start to get that incidence of prostate cancer. And then certain ethnic groups and are at higher risk for it. This is always a little bit difficult to tease out sometimes, and there's lots of discussion about whether or not it's really a socioeconomic thing versus a true genetic thing, because there's some discussions about which one's more significant, but certainly I think the evidence would suggest that particularly in the Black community, whether it's African-based, Caribbean-based, that the risk of prostate cancer is a bit higher. So that's where you really need to be a bit more careful, and that's why you see programs like this come out really for that.
For sure.
A family history of prostate cancer is probably the thing, however, that will probably be the most important trigger for people getting investigated and getting followed. Not only if you had it, but when you had it. Right?
Yeah.
It's a little bit different if your 55-year-old brother had prostate cancer as opposed to your 90-year-old great-grandfather. Right? It's a little bit different. And so those would probably be the three biggest risk factors. The only real preventable one, we think, is smoking, which is not unusual for cancers. It's just, so I'm not saying anything you don't know.
Right.
Most people know that smoking is bad.
Right.
It's bad.
Right.
I'm just giving you another reason why it's bad.
Got it. So can we, and again, super just coming from the world of Google, Instagram, TikTok, If a young man, let's say 25, should he not even consider checking? Or should he be able to say, you know what? My father had it or my grandfather had it. Where is that line drawn? Or do we start checking much earlier?
It's a very good question. So because the incidence really jumps after age 50, we usually start around 50. Now the details of exactly when to start will depend a little bit on your prostate cancer sort of risk factors. So if you're of African descent, they may start in the late 40s. If you have a family member who's been diagnosed with prostate cancer in their 50s, well, we want to catch people earlier. That's the entire point. So they may start in their late 40s, but certainly before age 40 be very rare. And so a 25-year-old person can certainly go about their lives being fairly certain that they do not have to worry about prostate cancer until their later years.
In the later years.
Yeah.
Got it. Okay, so then my next question is, how can it be diagnosed? How does one go to their family doctor? What are some of the tests that they do? And then the other part is, can it be treated? Can prostate cancer be treated?
Well, let's get the first thing out of the way first.
Yeah.
It can be treated. So, and this is part of why you'll see doctors make a real push for screening. People are afraid of screening though, because screening is all about picking up cancer early, before you get big time symptoms. So people always say, what are the symptoms of prostate cancer? In good faith, if you have the symptoms of prostate cancer, it's late in the game. And they tend to be the kinds of symptoms you get with bad cancers generally. Unexplained weight loss, poor appetite, and so on. Your prostate is part of your sort of genitourinary tract in a man, so you do sometimes get voiding symptoms and so on. But I don't want to frighten people, because voiding symptoms from benign prostate issues is way more common.
Right.
Okay? So most of the time you'll find your doctor speaking to you about screening before you feel anything. And you're like, well, why should I be looking? Because I don't have any symptoms. Thank goodness. That's when we want to find it. That's when it's curable. That's when we can really do something about it. The two main ways that we diagnose prostate cancer is by physical examination. So we can actually examine your prostate. It's actually fairly low in your body, close to where, essentially behind where your scrotum is. So behind the bag, as the guys will call it.
Right.
And so when you do a rectal exam, you can actually feel the back side of the prostate.
Oh.
Yeah, and so that's called a digital rectal examination. People say, but does your rectum have something to do with your prostate? It's just, it happens to be behind it.
Right.
And because the rectum's not very thick, you can actually feel the prostate through the rectum. And they're feeling for areas that are hard, rocky, irregular, stuff like that.
Yeah.
So an abnormal digital rectal examination is a concern. There's also a blood test that's been developed called the PSA test. And PSA stands for prostate-specific antigen. It's not perfect, which is what people bring up all the time. And I say immediately afterwards, what test is? It has to be used in context of all the other things in order to make decisions. So just because something's not perfect doesn't mean we don't use it.
Right.
It just means we have to think a little bit more about it. And it's a very easy blood test. Doesn't hurt. It's much like most other blood tests.
Yeah.
And we use it with the rectal examination. So it has to be used with rectal examination, not by itself. They're used together in order to better figure out if people are at higher risk of having prostate cancer.
Right.
But those are screening tests. They're not diagnostic. So even if you have an abnormality there, like I said, these tests are not perfect, you have to have actual biopsies of your prostate done to really be sure whether or not you have prostate cancer. And so it's a process that we go through.
So when you say biopsy, so before I ask this question, I have a lot of older males.
Okay.
I'm East African, I'm Black, I'm Muslim, and so I come from this culture where the older men just kind of, they go back home. And they're like, well, I'm just going to be in the sunshine. I don't want to deal with this. And whatever comes about, comes about. And so that being said, I know that there must be some type of fear, shame, stigma of being checked physically. Like we talked about being physical. Can you really just dive into that? Is it painful? Is it quick? Like, what is it that they're so afraid of that could potentially save their life?
Absolutely. So this is a very taboo area, much like any discussion of things to do with your urinary tract, your genital tract. That's not unusual in society, unfortunately. It's getting better now as we are more open. We talk more about sexual orientation, sexual identity. Right. These discussions are now becoming more everyday as opposed to specialized discussions. So it's taking a little bit to get over that. We also recognize that when you talk about any kind of genitourinary cancer, really in particular prostate cancer, the big concerns for people are really things like, oh my God, am I going to become incontinent? Like, am I going to pee myself. Like that sucks.
Yeah.
I don't even want to talk about anything like that might be associated with that.
Right.
And then also, what about erectile function, right? Because again, it's a genital tract issue. So is it going to affect that? Well, then I'm out. I don't want to talk about that. But what we're trying to emphasize to people that this is really about, particularly when we screen, diagnose, follow people, we shouldn't be afraid of the possible end result. We need to be afraid more of the potential fallout from cancer-related death. Like, this is serious.
Right.
And when you get investigated, it doesn't commit you to anything. It's a discussion. It's a process. So don't be afraid. We haven't reached any point where we're talking about, as of right now, we're talking about screening, prevention. We haven't talked about getting to the point where you need like weird aggressive treatment and so on. Like, get in the system. Get things done early so you have options.
Can you say that it's quick? Like, can we say, if I talk to
Absolutely.
my uncle, can I say, uncle, it's painless and it's quick, just to screen?
Absolutely. Quick, easy, painless, not that much to think about. And particularly for a lot of screening tests, thank goodness, we're going to talk a little bit about incidents and so on.
Right.
A lot of people are going to be negative, and that's good.
Yeah.
But you need to make sure that you're the negative one.
Right.
Right? And if you are, high five. Awesome. You've lost nothing.
Right.
Right? And for those who are positive, yes, we have to have more difficult conversations, but wouldn't you prefer to have that before you have to deal with big time fallout?
Yeah. Well, based on my research, speaking of incidents, I want to just run some numbers by you. I don't know what any of this means, so I would love for you to explain it for me, the viewers, the people that are watching. So according to the data of Ontario Ministry Health, Black men in Ontario are more likely to be diagnosed in prostate cancers than other communities. And I really don't know what you think of this sentence, but they are less likely to die from the disease.
Right. So the likelihood of dying from cancer is multifactorial. It's not just based on race, ethnic background. It's based a lot, in fact, on socioeconomic background and so on. We've tried to tease out some of those things to try and get better information on it, but it's hard. We don't collect a lot of race-based data in Canada, so we can't speak to what happens in a universal healthcare system like ours, where you basically show up.
Right.
You don't have to pay out of pocket for most things. In the States, because of that private side of it, and you have to pay out of pocket, it's hard now to dissociate that from the socioeconomic situation, which affects Black people more significantly in the US than other groups. So it's difficult to comment on that. I would argue that it's probably at the very least similar. And if the socioeconomic side makes it so that you're having more deaths, which I think most people agree with, then it's hard to fix that. So we have to compensate on the other side, on the medical side. So we're going to be more aggressive on the medical side to compensate for socioeconomic side that's much more difficult to address.
Got it. So we've talked about prostate cancer diagnosis. Can it be treatable? Can prostate cancer be prevented? I know we've talked about the diagnosis. It takes 5 minutes. It's painless. Can it be prevented? And what are some of the things that people can do to prevent it?
Okay. So prevention of prostate cancer is a little bit different than some of the other cancers, all right? A lot of cancers are obvious. Don't smoke. That's number one, okay? So it's true for prostate cancer too, although not to the same extent as something like lung cancer, where it's really obvious, okay? So for everybody out there, please don't smoke. There's way more reasons not to smoke than this, but this is another one to add to your list.
Right.
In terms of other prevention, not a ton. But the most important thing we tell people, and this will feed into a lot of the other chronic disease stuff we're going to talk about on these talks,
Yeah.
is really when you make your health good, you give yourself the best chance for anything. We're all going to get something eventually. But there's something that we get, we want it to be something that we can't do anything about, that it was just inevitable.
Right.
And when you keep your health good, when people now have to try and manage things and so on, it's so much easier.
Right.
So please, for everybody out there, eat right, exercise regularly, don't smoke.
Don't smoke.
It's amazing how those three basic tenets are important across the board.
Right. So I think there's a difference between preventing and risks. I really want to touch on that. But before, I have a little bit more facts during my research. And so my other facts that I really wanted to use with you was that the Ontario Ministry of Health, in 2017, the incident rate of prostate cancer among the Black community, Black men in particular in Ontario, was 131.2 per 100,000 versus or compared to 105.5%, 105.5 per 100,000 amongst other communities. I don't know what I just read. What does that mean in terms of Black men health?
Okay, so a little bit of a math alert for all those who are afraid of math. The reason why they stated this way is you notice those numbers are relatively small. They're less than 1%.
Right.
That does not mean the numbers aren't significant, however. So we report them per 100,000 in order to make the number real. 132 per 100,000 is way different than, say, 0.013%. Like, it makes it more relatable. That difference that you see there is not an insignificant difference.
Right.
If you look at the numbers, a little bit of a math alert again, it's almost a 25% increase in incident. Like, that's not a small number.
Compared to other
groups, that is a big number.
Right.
And so it emphasizes the importance of really screening this group. And this is part of what this is about getting that information out so people know. Like, you can't change that, but what you can change is how we manage it, how we screen for it, finding people early in the diagnosis and being able to do something to help them.
Right. And then that kind of brings back what I said earlier is the risk. So what is the risk of developing prostate cancer?
Right. So in your lifetime, overall, so let's take all men. Let's remove some of the details. You probably are looking at like 10% of men at some point in time in their life getting a diagnosis of prostate cancer. Somehow, whether it's from screening, whether it's being picked up later, somehow.
Right.
That is a massive number.
Right.
That is in the same realm as breast cancer in women.
Right.
And so that's why you see these very aggressive public campaigns for screening, because if we know you're going to get it, we might as well find it early and do something about it.
Right.
And that's where we get into the differences between prevention and risk. Risk is kind of, what are your chances? Prevention is an active process to try to prevent something, to actually stop something from happening. And one is more controllable than the other, right? And so, like, you can't control your ethnic background. That is what you are. And so, but what you can control is, do you get screened? Do you get screened at the right time?
Right.
Do you get the right tests?
Right.
That you can control.
It's about, I really hear you saying it over and over, getting in there early. I think that's the main message, is getting in there early, and it's painless. It's easy. It takes 5 minutes.
Agreed.
And so now, for the viewers who are watching, for the Black families out there, a loved one has been diagnosed with prostate cancer. That information is verified. They did do the diagnosis. They did do the screening. What are some of the complications, potential complications, if not treated properly?
Right. So this feeds into why we screen for prostate cancer early in the first place, right? Because advanced cancer, unfortunately, the number one thing that we worry about is death. Like, that's the whole point, right? And potentially preventable death. Like I've just said, we will die eventually, but it would be nice to prevent the things we could prevent.
Yeah.
Other than that, we're looking at this spectrum from, it wouldn't be early anymore, it'd be sort of mid-disease to late disease. And this is where we get into some of the symptoms that affect the organ system that's involved, right? Because your prostate's a part of your genitourinary tract. So sure enough, you get genitourinary symptoms. You get issues with your peeing. You can get blood in your urine that you can see. These things sound simply like, so I pee a bit more, I have some trouble peeing. It becomes very difficult to fix with cancer, because remember, this is uncontrolled replication of cells. Right. So it's not like we can stop it. Right. We temporize it, we do things involving catheters and so on. I would argue if people saw some of the things we have to do to help manage people with advanced prostate cancer, they would get screened more quickly. They would worry less about theoretical potential complications as opposed to real, oh my God, this could happen to me. And then the usual stuff with cancer, like advanced cancer really is about body systems shutting down, depending on where the cancer goes. So prostate cancer, for example, has a predilection for bone. It tends to go to your bones. We're not 100% sure why. And so people get pathologic fractures. So your bones just break for nothing.
Yeah.
You know, you trip and suddenly your arm's broken. You're like, but it wasn't that bad. Well, if cancer's eating into your bones, it's not as strong as it used to be.
Right.
And so that's just one of the areas. And it can go to a number of different organ systems. You'll find that in cancer. Like, cancer spread in certain patterns. And it just so happens that in the genitourinary system for prostate cancer, it happens to spread in that pattern. Mm-hmm. But those are kind of some of the things you have to deal with when you don't find this early enough.
Mm-hmm. You know, I can only speak from what I see in my own immediate family. The word cancer is, a lot of people are just scared. Put your head in the sand, don't talk about it, don't think about it. There's a lot of just rumor mills, right? Somebody told you something, you heard something else. And so I really want to touch upon the coping mechanisms that are there. Somebody, again, a loved one has been told that they are diagnosed with prostate cancer. How does one cope with this information?
It's an excellent question. So my first response to this is always make sure you have accurate information. We do in cancer what's called staging. It's a sense of where you are in the cancer process, early versus late. That provides a context for people to be able to understand what it is they're going through, right? When you're early in the game, as you read up on prostate cancer and so on, yes, a lot of the clickbait and a lot of the popular sites are going to be on the extreme stuff because it's interesting and very dramatic.
Yeah.
And that's what draws your attention. But if that's not you, guess what? It doesn't matter right now.
Yeah.
And again, the whole point of diagnosing people early is not to get to that point.
Right.
So accurate information, in particular staging, is point number one. Point number two is making sure you have things in the correct context. This is where talking to your healthcare professionals is key. Because your fears, your concerns, and so on, bring them up. And you'll be surprised how quickly they're like, oh, wait a second.
Yeah.
That just doesn't apply to you.
Right.
You're like, oh, but that
And
was
you're
easy.
getting the information right there,
Right there.
live, instead of going on these 1,000 forums, Google, and so forth and so forth, whoever decided to write it up. So asking your
Absolutely.
your medical professional.
And bring your concerns. Don't be shy. Like people sort of sit down and say, well, I hope they're going to probably address this concern that I have.
Right.
But sometimes your concern is very different than somebody else's, or it's personal to you, and that's okay. You know, people have family members who struggle. People have, and they want to know that that's not going to be them, or what they can do to prevent it, or how to manage it. Just say so. And so I must admit, I'm not averse at all to people bringing information from online and so on. I don't. But don't just read it, kind of have a vague idea of what it is, and then come to the meeting. Like, print it out, bring it with you, write something down. Don't be shy. Like, you be specific, and then I will be very specific. And then I will make sure that you have confidence in what's going on.
Right. Knowledge is power.
Absolutely.
Exactly.
Absolutely.
You know what I just thought about, which is not in one of my questions, but I'm going to ask. You are a black man. You are from Trinidad.
Yep.
You're in this world of conversation of prostate cancer.
Yep.
Prostate cancer happens to men. How do you deal with this information every day? It's all around you. It's what you have a conversation about. Do you ever think about your future? I don't think you're 50, by the way.
Not yet.
No,
but getting
yeah.
there.
Yeah.
Getting there.
But that's, how do you deal with this information? Does it keep you up at night to think to yourself, what does this mean for you? Because you fall into these categories.
Excellent question. And the answer for me is no. And that's good. Because if I'm freaking out about it, you should really freak out about it.
Yeah.
No, again, it's about information. I know what my risk factors are. I know I'm getting screened appropriately for my age and for my family history and for all those things. I don't smoke. I eat right, keep healthy as best I can. So I've given myself the best chance. If I get it, because I can't prevent everything, I can't control all my risk factors, then I know I've given myself the best chance to do well. Wow. And so I believe that. And so when I'm telling patients that, I'm telling them what I believe. Like, and you're 100% right. You can look at somebody and say, wait a second. He's in the same boat I'm in.
Yeah.
And he's okay, and he seems pretty chill. Okay, I get it. And that is critical in terms of managing these kinds of things.
So we talked about earlier that cancer spreads. What was the word that you used?
Metastasizes.
Metastasize.
That's right.
You're the expert here. And so how does prostate cancer affect the overall health of an individual?
So again, like with most cancers, it takes something from you. Remember, this is uncontrolled cell replication and spreading to areas where it's not supposed to be. So it's basically stealing resources that you need for other things, and it's interrupting normal function of other organ systems. All cancers do that. It's just a question of exactly how do they do that. And so they can really eat at your overall health. That's why you'll find that for a lot of us, when we talk about cancer care, a lot of times we stop talking about the cancer for a little bit and start focusing on your overall health, saying, look, it's really important we control all these other health factors that you have. Really make sure you're doing the things that will help your health, right?
Right.
Eat well, exercise regularly, don't smoke.
Right.
You do those three things and you do them well,
Yeah.
you suddenly find that A, you have tons of options in terms of treatment, management, and so on. B, you do better. It's amazing how people say, how lucky that guy is. And then you see the guy is somebody who's taking care of their health, trying to take care of themselves and so on. And you're like, that's not luck. That's work.
Right.
And it's payoff now.
Right.
And we really want to emphasize that. People really hyper-focus on the cancer and say, what can I eat to stop this? What can I drink to stop this? What magical remedy can I do? If you control your risk factors as best you can, get screened, and take care of your overall health, you will have done everything you can. And that's why I have a job.
There you go. Really just going back to the basics, which is exercise, eating healthy, not smoking, and you have a lot better chance than someone who's not taking care of their
Absolutely.
health, right? And so I want to really close up this conversation. Thank you so much for having this just time with us. You're very passionate about it, and that really just shows me that you care. And so for individuals who are going on this journey, what are some of the supports, resources in managing the prostate cancer diagnosis?
Good. So first and foremost, obviously your family doc, they tend to know you, they tend to know you well. They also tend to have a better sense of your overall health issues. So they will be the ones who sometimes support you in a different kind of way, where it's not just you have this cancer diagnosis, it's also you have this cancer diagnosis, but I'm gonna make sure everything else is tight so you can get through this cancer diagnosis as best you can, right? And as much as we talk about misinformation online, there's some very good information online. So I'm biased. Obviously, I'm a urologist. I'm Canadian. So the Canadian Urological Association has a lot of information online. Prostate Cancer Canada, who I've done some work with in the past. So I know that group very well. And they don't just offer scientific information. As you've appropriately pointed out, there's more to cancer diagnosis than the cancer.
Right.
It's how to deal with it. It's talking to somebody else who's dealt with it.
Right.
It's knowing what your options are from the side of somebody who's had to think about it themselves, or who's somebody's family member who's had to think about it themselves. Prostate Cancer Canada offers all of that. There are others like that, but they're just kind of one of the best ones. Obviously, you're a specialist in the area, so whether it's urologists, obviously with prostate cancer, oncologists, whether radiation, medical, there are other types of oncologists that we often put you through to, so you can talk to them as well for some expert opinion as to some of the issues involved, and they will certainly help. And then again, really focusing on making sure that the cancer doesn't control your life. You control your life.
Right.
So you make sure you do all the other things that are necessary for you to live. As I like to tell patients, my job's not to like disrupt your life. My job's to enhance your life. So remember, you have a life.
Right.
Family, friends, and so on. And it's not about hiding it from them so nobody knows and nobody can worry.
Right.
It's about understanding what you have to go through and making sure that they understand too, so that they're not afraid, so that they are appropriately concerned, because it's not a joke, it's a serious issue, but not panicky or losing the context.
Right.
Because there's lots of hope.
Right.
That's the point, that there's lots of hope. That all this talk about screening and searching and treating and diagnosing is because there's hope.
There's hope there. Thank you so much, doctor. It's honestly, like I said, the word cancer can be very scary, but what we've done is provided a lot of knowledge, a lot of information for people to go seek out. And what did we say? Exercise, eat right. And what's the one thing? Don't smoke. There you go. So ladies and gentlemen, thank you so much for taking the time. Dr. Sean Pierre, thank you for taking the time as well. And ladies and gentlemen, there's so much information out there. Get screened early on. It takes a couple of minutes. It's not painful, as we heard from the doctor today. And so I hope you find this information knowledgeable as well. My name is Kadra Abdul. Thank you so much for taking the time to watch this. This is Taibu Health Community Center, public awareness for our Black community, as well as Caribbean, as well as African information out there for you guys. Thank you.
Yeah, my name is Mohammed Haji Aidan. I'm one of the community elders who have been here, being part of the journey that the community has undertaken, starting from late 1980s until today. And, the adjustment hasn't been, lack of challenges, but thanks God, things are improving, and we are at a stage where we are trying to deal with those issues that are very important and affecting the community. As a leader in the community who has been in touch with so many aspects of the community and has been part of the people who have been serving the community, I receive information pertaining to the community, and part of that information is people who are affected by diseases, different diseases. And one of them is, two of them are those that you have mentioned. Yes, I know a number of people who are affected by either prostate cancer or colorectal cancer. As far as I can tell, and I'm one of the people who are very much in tune and immersed in the issues that affected the community, I cannot say that this two diseases affected our community proportionately in comparison to the other cultural groups. Maybe that's the case, but I don't have evidence-based information that I can respond to the question the way that you have framed it. very important observation that we should be taking into account in dealing with these issues is the background of the people. For example, many cultural groups come from countries and places where colorectal cancer or prostate cancer is never heard of, or people don't pay that much attention to. But here in Canada, that is not the case. We know they affect people and they kill people. The most important approach that we should be thinking of is how we can engage these people, educate them, and share with them the importance of doing those tests, because the benefits outweigh the challenges, even though some people feel very hesitant to get involved in the tests because of the privacy issues that are involved in this. The fact that we are talking about these issues is a very important first step. I think we know that information is an asset. Once you have the necessary information, then people can make objective decisions. So one of the things that we should be doing in the near future, or as quickly as possible, is to, conduct a campaign to educate the people. Education, I think, is the most important tool that is available to us, and one that we hopefully will convey the message that we are trying to get across.
Today, we're going to be talking about colorectal cancer. This is something very new to me and some of you watching as well, but this is what this segment is about, is creating knowledge, wisdom, and information about this subject. So who do we have today? We have a very knowledgeable doctor, Dr. Anike, and I'm not going to try to say his last name, and he'll tell us a little bit more about himself. Thank you so much, Dr. Anike, for joining us. Please let the people that are watching know, how do you say your full name? How did you get into this practice? Tell us more.
Oh, anyways, my name is Dr. Anike Ugochukwu. Ugochukwu, yes. It's jaw broken anyways. A lot of people try to pronounce it, but they fail by the wayside. It's difficult to pronounce anyways.
I'm one of those people.
Yeah, it's pronounced Ugochukwu.
Amazing. And where are you from, by the way?
Okay, originally I'm from Nigeria. Yeah, okay. So. Yeah.
Were you born there? Did you grow up there?
Yes, I was born in Nigeria, and of course in the eastern part of Nigeria. Amazing. Yeah.
And how did you come to Canada? How did you get into the practice of health? And tell me more.
As a matter of fact, when I was growing up, I wasn't thinking of reading medicine, actually. No, I wasn't. But seeing my mom died, at a very young age, that motivated me to begin to think of a way to see if there's a way to prevent people from dying young. From there, I now decided to explore the possibility of becoming a doctor. And as luck will have it, of course, I studied hard, but again, I wrote the exams that were, to be written, and I became successful, and that is why I became a doctor.
Amazing. I
trained in Nigeria, and after my graduation in Nigeria, I worked for 6 years, I should think, and left to South Africa, and went back to school to become a consultant, a specialist in family medicine, because I thought family medicine is one of the courses or disciplines that will help to prevent diseases. As it involves meeting the people at their early stages of condition, which if you find them at that early stage, it will be able to, and if you do all the necessary things you need to do, it will curb the diseases instead of allowing it to progress. So that motivated me to go into family medicine, and that is why I studied family medicine.
Wow. Well, thank you so much for making that decision. I know it came from a special place in your life, especially in your earlier years as well. And we need more people like yourself, a Black man, a visible minority, African, because as individuals, Canadians, when we're looking for family doctors, it's people like you that we can connect with on just a foundational level. So thank you so much for doing that. And today we're going to be talking about colorectal cancer, which I don't know much about, but I did my Google searches. That's what I've been doing with all of these campaigns because it's the general information. So what do I know so far is colorectal cancer is the type of cancer that develops in the colon or rectum, which is part of the largest intestine. But that's basic, right? And so my question to you is, what is colorectal cancer?
I don't think there's a lot more way to define it. Same thing you just said now, that colorectal cancer is a cancer of the large bowel. The large bowel encompasses from the colon down, rectum, sigmoid column, and cecum, other areas of the large intestine.
Right.
It can be in any part of that large intestine, and we'll call it colorectal cancer.
Okay.
Which is a malignancy.
Okay, and what does that mean in layman terms?
Cancer is, a very, how do I say it? It's a condition that when it affects a particular part of the body, it tries to eat the part of the body up very fast. And if care is not taken, can claim life. So that's why it is very important that we do a lot to see what we can do to prevent it from, happening, and if it happens, to treat it as fast as we could to preserve life.
Got it. And what are some of the risk factors in developing colorectal cancer?
Okay, if not, sometimes you may not even have any risk factor in terms of what we predispose somebody to developing colorectal cancer. However, research has found that people who are, come from a family that has, developed, or if a member of a family has had a colon cancer, that there may be, chances of one developing colorectal cancer. That is one thing. Two, age is also very important. As we grow older, one expect to may develop colon cancers, from 50 years upwards. That's why we do a lot of screening tests from the age of 50, unless
Onwards.
there is a family history of colorectal cancer. In that case, we will modify the age at which we start screening. Okay? Having talked about the risk factors, there are other things we also look at. For example, researchers also say that people who have, polyps, in the large bowels can as well develop colorectal cancer, in as much as those who consume a lot of fatty food, and again, without, taking in a lot of fiber, like red meat as well. People who eat a lot of red meat can as well develop colorectal cancer as well. Again, genetics is important. There are families who have these different kind of genes that predisposes them to colorectal cancer. There's what we call FAB, which is familial adenosis polyposis. Okay, adenomatous polyposis, and the HNPPCC, okay? People who have such gene are more predisposed to getting colorectal cancer.
Is it naive for me to say in terms of gender, right? Women versus men, who has a higher risk of developing colorectal cancer? Would it be men? Something like prostate cancer, because I hear prostate cancer. Is it more towards men?
Prostate cancer is in men because men have prostate, women don't have prostate. But in terms of colorectal cancer, it's not well defined whether it's more in male or female.
And it would be, we talked about red meat. It seems like diet is one of the risk factors, right?
Yes,
so if one decides to have no red meat, no meat at all, actually, they're vegan or vegetarian, do they have a zero chance?
No, but remember I say that risk factor, that there are other people that even developed colorectal cancer without having any risk factor at all. Okay? So yeah, but again, people who eat more of red meat can may develop more colorectal cancer than others that don't indulge in a lot of, that. People who eat a lot of fiber food, they do well with, in terms of developing colorectal cancer, it's least, among people who eat a lot more fiber than, red meat.
Got it, got it. Thank you for explaining that, because these are some of the questions that probably other people have as well. And so how can colorectal cancer be diagnosed as well as treated?
Okay. So in terms of diagnosis of colorectal cancer, it takes us back again to what we talk about screening, where we talk about screening. So screening is, one way, or rather the main way of identifying people who may develop colorectal cancer, okay? So in a community or in a family where there is no risk factor, nobody in the family has developed, colorectal cancer or have got polyps, then we do what we call a, fit test, in that case, usually the department sent out, thing to the mail, and you pick it up and, smear the stool, and that eventually will go into, chemical analysis, and they check whether you will do further testing or not. You call it, either a FOBT test or a FIT test, okay? But in a situation where there is risk factor, people go with, colonoscopy, where they can, use a, camera going through the bag to check if there's anything that could be found, okay? Now, people who complain of certain abdominal issues, pains, weight loss as well, generally, or people who pass blood as they during defecation, are subjected to further investigations to see if things can be found, and then if something is found, treatment can be pursued, and treatment of colorectal cancer usually also will depend on the staging. Okay, when the surgeon.
The stage of where we're at.
Yes.
Okay.
Yeah. So if there is, a tumor found, that is removed and go for further analysis, what they call maybe histology, testing, and at the end of the day, we'll try to, classify the tumor based on how bad it is, and grading and staging will take place, and the treatment will start. Usually, surgery is one of the mainstays of treatment. We'll do a surgery, and again, depending on how it is, we can also do some chemotherapy using medications as well, and again, radiotherapy can as well be part of the treatment regime.
Yeah. So if one is watching this and has history in their family of having colorectal cancer, what are some of the ways that they can change their lifestyle to prevent it?
Yeah, being proactive is very important. Make sure you see your family doctor. Make sure you're able to let them know the history in your family. That will now help them to determine what further testing that you may require.
Yeah, okay. So let's go into the hypothetical someone has been diagnosed with this information. What are some of the complications that someone may experience? They've been diagnosed with colorectal cancer and it's not being treated properly. What are some of the risk factors, some of the potential complications that they may experience?
Okay, complications are varied and wild. Bleeding is one of the things one can experience, of course. But what is very, very more important is the spreading of the condition if it is not well treated. The earlier we treat the condition, the better it is for the individual, because then you are trying to cure at early stage. But when it's not properly diagnosed or managed, it spreads and can go to different part of the body, and life is likely to be lost at a very early stage. There are other complications which might include perforation of the bowel as well. Of course, anemia. You're losing blood, one becomes anemic. Lack of blood in the body is also one of the complications one can get as well. And it can as well cause intestinal obstruction, because in that case, if the tumor becomes, grows so much, it can block the passage, and that can lead to obstruction as well.
So if someone has this information, they have been diagnosed, what are some of the ways that you could just maybe advise in coping with this new information, changing of their life? How can they cope with this diagnosis?
You see, in medicine, we have different organizations, people who deal with the fallout in terms of different kind of conditions. Okay, so one can be referred to be part of a community that where colorectal cancer has been diagnosed, and we learn from them all the things that may help in coping as well. Just like people who smoke cigarette will develop a kind of such organization as well that try to speak about smoking and all that. That reminds me, part of the risk factor for colorectal cancer is also smoking. People who smoke a cigarette stand a chance of developing colorectal cancer more than people who don't smoke cigarettes as well.
So we'll conclude with this segment. You've provided so much knowledge and wisdom around colorectal cancer. When I first started having this conversation with you, I didn't know much about it as well. And so for those watching right now, if a loved one has been diagnosed or they have been diagnosed, where are some of the places that they can find support and resources regarding colorectal cancer?
Let me say this. One important thing is to get the diagnosis of colorectal cancer as quickly as possible. And this could be done by we, the people, going to see our family doctors, telling them how we feel, letting them know the family history. If our relatives have got polyps or colorectal cancer, cancer of the bowel, letting our family doctors know. By letting them know, they will be proactive. They will inform you of the next step to take to make sure that screening are done and the proper screenings are done as well. Now, for resources, I'll still direct you back to your family doctor, because the family doctor connects with the community and the resources that will help to let you know about the coping mechanisms, assuming one is diagnosed with such a condition. Remember that the family doctor has a link as well to the specialist in terms of the consultants, surgeons, the oncology department as well. These are the people that we manage further when there is a case of colorectal cancer. So at the end of the day, it is still going back to your family doctor. He probably will also direct you to some of the internet readings as well, resources, and maybe be able to inform you of the community resources if there were, depending on which community you reside. So at the end of the day, it's still going back to the family doctor to continue.
Yeah. This has been a reoccurring theme in all of the campaigns that we've done in all of the segments, is like, again, really connecting to your family doctor and being honest. So thank you so much for providing this knowledge, taking the time to sit down with us. Dr. Anike? Oh, amazing. I'm not even going to try to do it. We've been doing this the whole entire time. So thank you so much, doctor. And for those of you watching, I hope you were able to find some type of nugget of information and knowledge on this as well. And it goes back to really connecting to your doctor, being honest, being transparent, giving that information. And remember, that's a safe space to start. And being able to find your diagnosis or your treatment very early on is something that keeps happening in conversations regarding all the other segments that we've done. So thank you so much for taking the time to watch this. We really appreciate it. My name is Kadra Abdul. Again, this is a public awareness campaign brought to you by Taibu Community Health Center for our Black, African, Caribbean community. So I hope you found this very knowledgeable. Thank you.
Yeah, my name is Mohammed Haji Aidan. I'm one of the community elders who have been here, being part of the journey that the community has undertaken, starting from late 1980s until today. And the adjustment hasn't been, lack of challenges, but thanks God, things are improving, and we are at a stage where we are trying to deal with those issues that are very important and affecting the community. As a leader in the community who has been in touch with so many aspects of the community and has been part of the people who have been serving the community, I receive information pertaining to the community, and part of that information is people who are affected by diseases, different diseases. And one of them is, two of them are those that you have mentioned. Yes, I know a number of people who are affected by either prostate cancer or colorectal cancer. As far as I can tell, and I'm one of the people who are very much in tune and immersed in the issues that affected the community, I cannot say that this disease, two diseases, affected our community proportionately in comparison to the other cultural groups. Maybe that's the case, but I don't have evidence-based information that I can respond to the question the way that you have framed it. Very important observation that we should be taking into account in dealing with these issues is the background of the people. For example, many cultural groups come from countries and places where colorectal cancer or prostate cancer is never heard of, or people don't pay that much attention to. But here in Canada, that is not the case. We know they affect people and they kill people. The most important approach that we should be thinking of is how we can engage these people, educate them, and share with them the importance of doing those tests, because the benefits outweigh the challenges, even though some people feel very, very, very hesitant to get involved in the tests because of the privacy issues that are involved in this. The fact that we are talking about these issues is a very, 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 very important first step. I think we know that information is an asset. Once you have the necessary information, then people can make objective decisions. So one of the things that we should be doing in the near future, or as quickly as possible, is to, conduct a campaign to educate the people. Education, I think, is the most important tool that is available to us, and one that we hopefully will convey the message that we are trying to get across.